In this next section, we examine some of the common exercise misconceptions and how to appropriately apply the four major components in a program. We begin with aerobic exercise. Aerobic exercise improves heart and lung capacity to build greater endurance in the body. Fact: aerobic activity improves tissue perfusion, heart contraction, lung capacity, and promotes enzyme production for greater substrate utilization.
Aerobic exercise is the best method to burn fat. Fiction: steady-state aerobic activity is a poor choice for fat loss in the obese individual. Fat loss is best achieved through resistance training, anaerobic interval cardiovascular exercise, and proper diet.
Aerobic exercise is the best method for weight maintenance. Fiction: high-frequency, long-duration aerobic exercise produces catabolic hormones that break down fast-twitch, highly metabolic muscle. This process reduces one's ability to maintain their current caloric intake levels without considerable weekly activity.
Aerobic exercise is the best method for blood sugar management. Fiction: aerobic exercise may lower daily blood glucose levels in the short term, but over the long term may reduce muscle mass that could compromise one's glycogen storage ability. Instead, focus on building lean muscle mass and consuming a nutrient-dense diet.
Lastly, aerobic exercise is the best long-term strategy to maintain optimal longevity, vitality, and aesthetics. Fiction: frequent high-endurance aerobics decreases muscle mass, increases catabolic hormones, and exhausts mineral reserves.
Let's now examine anaerobic exercise. Anaerobic exercise is better than aerobics at reshaping the body and raising metabolism long term. Fact: anaerobic exercise stimulates hormones that build muscle tissue in a metabolic environment that reduces blood sugar levels, thus limiting lipogenesis.
Anaerobic exercise is the primary way to boost oxygen utilization in the body. Fact: VO2 max improves when engaging in anaerobic exercise. This type of exercise increases capacity to withstand the buildup of waste substrates and efficiently reutilizes them in the body. Anaerobic exercise increases endurance and the ability to fight fatigue.
Anaerobic exercise will cause injury. Fiction: most injury is a result of inadequate warm-up, poor program design, or improper technique. It is usually not a result of the modality.
Anaerobic exercise, i.e., high intensity, is only appropriate for youth and males. Fiction: anaerobic exercise is a very efficient and effective process for all healthy individuals to raise anabolic hormone levels and burn fat.
Anaerobic training is reserved for athletes. Fiction: the purpose of increasing intensity is to improve the capacity of the body. Frequency is more closely associated with conditioning improvements.
High-intensity exercise does not burn fat. Fiction: this belief is tied to target heart rate dogma. Fat burning in general is tied to healthy hormonal balance. Caloric expenditure at any intensity is not necessarily indicative of fat burning.
High intensities should be practiced on a frequent basis. Fiction: intensity and frequency are inversely related. The goal of a wellness plan is to follow an efficient program as intensely as possible that delivers or maintains desirable adaptation with as little commitment as possible.
And finally, interval training is the best strategy to increase metabolic rate. Fiction: it is secondary to a low-sugar, high-fiber, and moderate protein diet. Anaerobic exercise increases EPOC, excess post-exercise oxygen consumption, and promote fast-twitch muscle tissue development. But for most wellness clients, it is too intense to practice long-term.
Moving on, we will now focus on resistance training. Fact or fiction: resistance training takes up too much time. Fiction: stimulus is based on conditioning levels, but beginners and intermediate clientele can make adequate progress with 3 20-minute sessions per week for 3 months, then progressing to 30-minute sessions.
Resistance training is only for athletes or men. Fiction: proper weight training is the most effective intervention to resist age-related muscular degeneration and prevent chronic disease for both sexes.
Resistance training will injure the client. Fiction. Only if exercise techniques are poor, the program is improperly designed, or the weight loads are excessive.
Weight training will cause the client to get bigger and negatively impact their aesthetics. Fiction. This will only occur if their hormones are imbalanced and fat metabolism is compromised. Muscle is utilized to recontour the body. Thus, anthropometrics will improve and an individual will appear smaller when following a properly designed program.
Resistance training is the best exercise recommendation to increase metabolic rate. Fact. The addition of 3 pounds of muscle adds approximately 18 to 40 calories a day to the basal metabolic rate.
Resistance training is the primary method to increase glycogen stores. Fact. Glycogen is secondarily stored in the muscle cells, liver is primary, and muscle loss will thus greatly impact blood sugar metabolism.
Resistance training is a primary method to increase muscle size and strength. Fact. Muscle fibers adapt to increasing loads, and strength is related to the cross-section size of the muscle tissue.
Up next, we examine flexibility, our last component in the wellness program. Flexibility can only be performed statically. Fiction. Modes include static, ballistic, dynamic, myofascial, and PNF patterns.
Flexibility needs to hurt to be beneficial. Fiction. Intense pain is not an acceptable goal with any exercise recommendation. Excessive static eccentric contraction can lead to joint integrity compromise.
Flexibility training takes up too much time. Fiction. Current effective protocols range from 5 to 15 minutes.
Flexibility training is not as beneficial as cardiovascular or weight training. Fiction. Muscle that can lengthen is a muscle that can strengthen. Short muscles tend to atrophy and cannot produce as much force.
Flexibility training is the primary method to decrease orthopedic stress. Fact. Adequate muscle length reduces strain on the ligaments and tendons, thus limiting shearing forces on the joint.
Lastly, flexibility training is a secondary method to maintain posture. Fact. It is followed by weight training and adequate nutrition.